Thank you for joining us. I'm Napoleon Nelson. I am a candidate for state representative here in the Cheltenham, Springfield, and Jenkintown area. What we want to do is talk a little bit about mental health. We know that we have a mental health crisis in our community, not just now, but we have been wrestling with this for many years now. And COVID and the current environment that we're in has really just exacerbated and shined a light on areas where our health system and our social safety nets have been failing us so far. What we're going to do today is have a conversation with a couple of wonderful local mental health professionals so that we can all understand how COVID is impacting us, some of the warning signs that we ought to look out for when dealing with ourselves and our family members, and understand a little bit more about what the road ahead is. So to each of you, I would ask that you would spend just a minute or two and introduce yourselves. You certainly just answer just who are you, and where are you practicing, and let us know.
Well, good afternoon, everybody. My name is Lauren Cain-Baxter. I am a master's level licensed professional counselor. I'm also a licensed behavior specialist, and I'm a nationally certified counselor. I am also the owner and lead clinician of Resilience Community Counseling, which is a community-based private practice in Elkins Park, Pennsylvania.
Thank you. Dr. Howard?
Good morning, everybody, or good afternoon, depending on where you are. My name is Dr. Janae Howard. I am a board-certified licensed psychologist. I have a private practice in Jenkintown, right outside of Philadelphia. I work with women, children, anxiety, depression, trauma. I've been doing this for about 25 years, even though I don't look it. It's been about 25 years, and I'm ready to answer whatever questions that you guys need help with.
Dr. Howard, if you could tell us a little bit about why you got into this profession in the first place. How did you choose mental health?
Well, I am somebody that is a product of anxiety. So as a child, I struggled with it, didn't realize what it was. Lots of times in the Black community, it's just told you're just shy, you know, just get over it, you'll be okay. But as I got older and made my way into undergrad, I realized that it really was anxiety. So at that point, you know, I got into this field for a reason, to help with hopefully dispelling a lot of the myths about, you know, mental health in the Black community. The majority of my practice are African Americans, and I spend a lot of time just trying to normalize, you know, what we're feeling, what we're experiencing, and, you know, hopefully just to kind of get more of us into treatment because it's needed, and we don't treat it like as equal as physical stuff. So I just want to hopefully just make it so that people are comfortable seeking out people.
Ms. Baxter.
Well, I was a Philadelphia school district teacher for almost a decade before I decided to return to graduate school to pursue my degree and license in a mental health profession. In my experiences as a teacher in several inner city schools during that time, I got to witness a lot of the trauma, the anxiety, the depression that both my students and their families were experiencing. And it became a challenge for me to continue to witness the impact that it was having on my students' ability to learn and their families' ability to thrive. And so those experiences kind of led me into this profession. I initially started out treating specifically preteens and teenagers, and it kind of evolved into doing more focused work with families, and particularly women of color.
So can you both talk to us a little bit about what we're doing now? So I know that we have had and talked about in the communities a need for mental health professionals for a long time. Can you talk about that need and particularly pay some attention to, as we're wrestling with COVID, how has that need been raised, elevated, as I mentioned before, just kind of, you know, heightened and exacerbated?
Well, I think that the need for mental health has always been there, but I think right now, as I tell a lot of my clients, you know, the world in particular is in crisis management and crisis mode right now, and we're just really trying to figure out how to manage ourselves during all of the uncertainty that's out there. So the need is really great right now because, you know, this problem is bigger than praying. This problem is bigger than going to your pastors and saying, I'm struggling with this. It's time to really reach out to mental health professionals like ourselves to kind of get that added level of support. It's more than just praying. Like, we need coping skills. We need stress management. We need ways of being able to handle being quarantined right now. We need to learn how to relate to our families interpersonally. You know, we spend a lot of times leaving the house and coming back. Now we're all together all the time, and we're recognizing an added level of stress. And if you have little children like I do, now you're a teacher, you're an educator, you know, so all these different roles are happening for a lot of us. And I think that, you know, that struggle is real for everybody. So my hope is to kind of normalize this for everybody and just say it's okay to reach out if you need support. It's okay to reach out if you need help. And the beautiful thing about telehealth right now is that we can do a lot of this, you know, online. So it's not like it's just like on the phone. Now we can actually see the person and connect with people that way.
I think for me and for my clients specifically, I am a very trauma-informed mental health professional. I have like additional training and certifications in trauma. And a lot of times individuals, well, for one, a lot of us don't even realize what trauma is, right? So we look at trauma as like when we hear PTSD, we think about the soldier who went to war. And so it's been an opportunity with this crisis to do more focused work with trauma survivors, helping them recognize actually what trauma is. Again, going back to the community, and a lot of us, in the way a lot of us were raised, a lot of textbook definitions of trauma where we were raised in those environments and experienced those things, but we just never realized what they were, right? It was just the way things were and you coped. Now, a lot of survivors of trauma have been triggered by all of this uncertainty. There is a comfort level. If you're a trauma survivor, you have looked for coping mechanisms, right? And a lot of the ways that we cope is to look for routine and normacy and like everything that we can, predictability, right? There's not much that we can predict right now. Like most of us are living day to day, week by week. And so it's triggering for a lot of those of us who have experienced trauma. And so I am finding that there are a lot of individuals reaching out to our group. They are asking for help because they don't realize what's going on. Like they feel like this is affecting them differently than it's affecting everybody else. And we're finding that the roots are in trauma. So that's a lot of the work that, and again, as the doctor said, the beauty in all of this is that we can do this and very important work through telehealth video. And it adds that extra layer of comfort for those who are experiencing trauma, depression, anxiety. There's an extra layer of connection there, like through that video therapy. So we're blessed to have that right now.
Is there something just chemical or biological that's happening with this? I mean, you know, I am admittedly one who doesn't understand the field, right? So I'm a finance guy, I'm a education in some ways guy, but understanding the physiology of the brain and how this is working right now is a little bit, and by a little bit I mean way above me right now. Is there something happening there that I don't know?
I would say absolutely. So our brain is comprised of a bunch of different neurotransmitters, right? And so when I talk to my clients about understanding depression and anxiety, I talk about the level of serotonin. So too little serotonin means that we're dipping low towards like depression, and too much is like anxiety. Because of all this craziness that's happening right now, I think people are swapping up and down. I think we're doing a lot of ping-ponging between being sad and low, and at the same time being overly anxious and distressed. So I would say there's absolutely a physiological response that's happening right now. You're also starting to see lots of people have like stomach and gastrointestinal problems that didn't have them before. I have a few clients right now that are complaining about diarrhea. You know, I have a few clients right now that are nauseated all the time and vomiting. And although I'm no MD, I do tie that directly to the stress response. So yes, I definitely think it is a physiological piece.
Yeah. So it's interesting because my husband asked me about this about 2 nights ago. And he said, what is the word you always use? Like psychosomatic? Like, what is that? Like, I hear you say that a lot. You know, and he's like, I noticed that you're on the girls about their sleep, and you're always asking, you know, how did everybody sleep last night? And, you know, how many meals have you eaten today? And, you know, so I think, you know, for a lot of my clients, and just friends, right, and family members that I talk to, even if you don't know the deeper meanings, right, the deeper things that the books talk about, all of us can kind of recognize those symptoms in ourselves, right? So I would say that probably most people have encountered some sort of sleep disturbance. Like whether you're, so I've been doing a lot of psychoeducation just on our circadian rhythm, right? And when your circadian rhythm is off, sometimes that's a telltale sign that there may be something going on as far as like stress and like your mental health is concerned. And so one of the first questions that I'm asking my family and my friends and my clients is, how is your sleep? And if their sleep is off, then it's getting into processing and the deeper reasons why it's off right now. Or how is your appetite? For a lot of us, when we're feeling like that stress, or we're feeling anxiety, or we're falling into a depressive episode, a telltale sign might be in our appetite, whether it's increasing or decreasing. So yeah.
That's fascinating.
That's probably kind of simplifying it.
Sure. No, that's one of the things that I'd love to make sure that so out of this conversation, some of this is just to help normalize and reduce stigma. Some of it is to help provide myself and others with those kind of warning signs that we can look out for. So I'm writing down, you know, sleep rhythms. I'm writing down appetite. Are there other kind of warning signs or areas that we should just continue to keep an eye on ourselves and our community to say, if you notice someone who is wrestling with this, or someone who is, you know, is it just any behavior that's out of the norm? I mean, nobody's ever had to wrestle with this before, so, you know, theoretically we've all got something going on. But what are those warning signs that that we should be a little bit more mindful of?
One of the things that I think is probably actually several things, but the first thing is maybe like watching the person's level of what I like to call irritability, or if they're starting to be a little bit more cranky or moodier than normal. Little things are starting to bother them that probably didn't bother them in the past. Might be something to pay attention to. Sometimes people's, you know, response is kind of to withdraw and try and stay to themselves and don't want to interact with others is another thing to pay attention to. And I'm going back to Ms. Baxter's comments about like the eating and sleeping. If you're noticing any changes there, then definitely pay attention to that. Sometimes if some people actually start talking, you know, a lot of what I like to call catastrophic thoughts, where they're like, Armageddon is here, the world is ending. You know, when you start to notice that, I don't want to be here anymore, you know, possible suicidal thoughts. Something else that I think that I'm noticing a lot with my clients is that the level of alcohol consumption that has been happening since we've been in quarantine. I think I was teasing with one of my clients the other day, and actually my husband, that, you know, we're all going to come out of this either master chefs or recovering addicts, because we're cooking all the time and people are literally drinking all the time to try to cope. So if you notice that the alcohol consumption or the marijuana consumption or whatever that person's vice is, it starts to kick up a little bit too much than normal, they're trying to cope with it, but at the same time they may be heading down a path where it's going to be difficult to pull themselves out of.
Yeah, and the eating too, right? I mean,
and the eating, absolutely.
Now, some of this I'm hoping that some of this is okay. You know, I'm hoping that I can still, you know, end my evenings with a glass of wine and a cookie, because my wife makes amazing cookies. But you know, we can monitor what is dangerous, or I mean, is that just something that we ought to, you each of us kind of knows what dangerous looks like?
Mm-hmm.
Yeah, I would say that, but I would also say that if it's starting to spill over into your workday, or it's starting to spill over into your ability to parent your kids the right way, or whatever relationships you have with people, that's where I would say. But yes, we're all going to gain 10 pounds. Just put it out there. We all are. We're all probably going to have an extra glass of wine, absolutely, because this is some craziness that's happening out here, and everybody has their own way of coping. But if it's getting in the way of you being able to function on your day-to-day, that's when I would say pay attention to it.
I would agree. Like, that's the key. Is it impeding your everyday functioning, your everyday quality of life? And if it is, then it bears watching, it bears processing. In addition, I've also noticed a lot of my clients who are not able to relax. So the clients who want to just keep it moving, right? Don't want to acknowledge the grief, right? In all of this, and so if you, I would say that might be one of the deeper signs. But if you notice that the person can't calm down and they just want to keep it moving, they don't want to talk about it, they don't want to acknowledge it, everything is fine, and are kind of in this overdrive, then I would say, that person also may bear, us paying some extra attention to,
Sure.
and kind of looking in on. Particularly last week, I'm not sure what it was about last week, but I saw and heard about a lot of suicidal ideation. Like the doctor said, also an increase in what we call unhelpful or unhealthy thinking patterns. So those irrational thoughts. And so if you start to see that pattern, like a person using a lot of should statements, or just saying things that we know are not, rational, even though we are going through a lot right now, then we want to be paying attention.
Okay. That's useful. So as we go through this, is there something that collectively we can do, right? So from my vantage point, the silver linings, and there are probably going to be a couple silver linings from COVID that it might be a little bit too early to talk about, but one of those many silver linings is just how the community is rallying around the community, and how everyone is trying and doing their best to pitch in, and we have the time. We're here. Where the community just feels like it's this wonderful being that is trying to build a web of support for each other. Now, we have to do this in our socially distant ways, and generally we're doing this from home, but are there areas that we can all help and look after each other, right? So what is it that we can do to help not just ensure that people get appropriate sleep, but is it providing and encouraging folks to get food and supporting food pantries, or what is it that we can do as a community?
I would say, I just did some work with Arcadia on this, and from a mental health perspective, there is something that keeps ringing over and over and over again in my mind, and I think that is just one of the biggest things that we can do is to make sure that we are a listening ear and a support, and that we are not, again, encouraging each other to just keep it moving, right? And to make sure that we are taking time to acknowledge the loss, to acknowledge the pain that some of us are going through. It may not necessarily be about meeting the physical needs of someone, but really trying to be attuned to the emotional needs, and validating them for what they are. Again, I will go back to the grieving process. Grieving is not necessarily bereavement. That it's not necessarily losing someone. It can mean losing something. We have a lot of teenagers, a lot of teenagers, a lot of women, a lot of men who economically are grieving, educational, as far as their education is concerned, they're grieving. They're grieving graduations. They're grieving parties. They're grieving connections that they had. And so being a listening ear and just acknowledging that for a person and validating that, and then also taking it a step further and helping them find meaning in that. So yes, we are all this is a very uncomfortable place to be in for all of us. But can we find, and this is where you start to move into the positive psychology of it, is there a growth, is there an opportunity for growth in this? Is there any meaning that you can find in this, as a society, but I think most importantly, personally? And if you can do that, and if you can be that person for somebody, it can mean a world of difference as far as their ability to cope through all of this.
Yeah, I definitely agree. And I think as a community perspective, I think really just trying to give people a framework around understanding what we're dealing with right now. Everybody should be nervous, everybody should be upset, everybody should be scared, and it's okay to be nervous, upset, and scared, but then also just reminding people that despite all of this is happening, there is support around you. There are places you can go to talk to people, making sure that people are staying connected with one another. I tell a lot of my clients, as much as possible, if you're talking to the person, make sure you see them. That really brings that human connection back, even though we're not able to physically be in front of people anymore, except for hopefully by June, but I think more like July. But anyway, you know what I mean? So up until that moment, just make sure that you can see that person, and just normalizing this for everybody. Even mental health professionals are right now. And it's because, nobody likes uncertainty. I find myself grabbing a coping skill or two every now and then when I've turned on the news for too long. You know what I mean? So just basically saying we're all literally doing this together. And you should not have to be going through this by yourself if you don't have to.
Sure. So let's tell me a little bit more about how this is putting a strain on the profession, right? So one of the areas that I want to make sure that we're thinking about is not just how do we wrestle with tomorrow, literally tomorrow, but how do we wrestle with that, the proverbial tomorrow when we kind of come out of this. I certainly believe that we're helping to shine a light on another one of the the shortcomings and failings of our health system. But how has your practice changed because of this, and how in the world does this kind of expose some portion of the mental health profession that the rest of us have no idea about?
Well, my practice is continuously busting at the seams, and I think now it's because, people are scared and they're afraid. I, on normal, get about maybe 5 calls a week for somebody to want to come in anyway, but now I think that's probably tripled at this point because, people are scared. The strain, I think, hopefully this will have a lot of people coming out of this saying, I want to do this work. That's what my hope is. There's not enough people that look like us that do this work because of the stigma and all the other stuff that's attached to it. And right now, the news talks a lot about, I think the number was 70% of African Americans are dying from this. And my numbers might be wrong, but I think it comes down to access to care, physical access to medical care, other stuff too, but that's a part of it. But I think there's also a gap between us seeking out mental health care. So my hope is that this will help people to really feel comfortable reaching out to somebody to say, hey, I'm struggling right now. So as a profession, and hopefully as a profession, we really need to step our game up here. We should be at the front of the news too. We got Dr. Fauci who's up there with, the person who's running the country right now. There needs to be some type of a mental health professional up there too. It's not just the physical stuff that's happening, it's the emotional piece that's coming with it as well. And, somebody needs to say, it's okay, we're all scared, seek out help if you need it.
I would say, from my practice, like the doctor said, we get calls continuously throughout the week on any given week or day anyway. Those calls have increased, and then they continue to increase as this thing moves on. As professionals, I'm trying to make sure that myself and everybody in my group that we are practicing what we're preaching and that we're taking care of ourselves while we're taking care of everybody else so that we don't burn out. Because it's imperative that we don't burn out right now. We need to be there for our clients. And in doing, we have to take care of ourselves to do that. There is also, I think I agree with the doctor when she says that, you know, some of the barriers are from learned behaviors and learned attitudes. One of the missions of my practice has been equity in all of this. Okay. And so that is why when I first opened the doors of the practice, I made sure that we were equipped with telehealth capabilities. Because we wanted to make sure that this service that we provide is provided in a very equitable way. That being said, I have gotten calls from individuals that are actively seeking out care, and the financial inequities are becoming increasingly apparent to me. And so, like I said, I started the practice to make this more equitable, right? Mm-hmm. So that not only so that those in the community could have access to good quality care, and we have done that through payment plans, through sliding scale, through accepting private insurance. But I would say one barrier that we have always still kind of run up against and continue is becoming even more apparent now is our ability to accept Medicaid, our ability to accept Medicare. Like I can't tell you the number of clients or CHIP for that matter, you know, clients that even though we are licensed, credentialed, and contracted with private insurance, it is very difficult to become credentialed and contracted to accept in our field Medicaid and Medicare. And so the disparities have become glaring. Like where they've always been there, now you kind of have to put on sunglasses to protect yourself from the glare. And we continue to try to work with clients, you know, for those who really are, you know, seeking out and in need of care. But there is definitely, I would say, still disparities and inequities.
Sure. Okay. Something that I will absolutely look into and make sure that we raise this call with those elected officials in Congress and throughout the state. Thank you. No, those are the sorts of nuggets that can become very actionable for us. So we will continue to pick that up, absolutely.
And I would say specifically in private practice, right? So like I have, you know, clients that like I refer out to clinics, right, who will accept CHIP, you know, Medicare, Medicaid. But those clinics are also swamped. And so, like, I think that there's like work to do in our field and in our community. You know, like the doctor, she talked about the lack of mental health professionals, qualified mental health professionals, licensed mental health professionals that look like us. And there are a lot of barriers there that still exist for us. You know, like for instance, like I have 2 members of my practice are not fully licensed yet. That is often you will find in agencies, there are a lot of mental health professionals that are not fully licensed because they need active supervision. We've kind of made it a point and a purpose to make sure that we're providing active supervision to those clients. That doesn't happen a lot in private practice. Mm-hmm. But a lot of times private practice is where you're going to get like that specialized, that real quality, right, mental health treatment. And so, you know, I think that that's a big place where the disparity comes in. You know, we have to make it easier and more accessible for those of us who want to do the work to actually become licensed and do the work.
Yeah. All right. So one of the final things for me is, so I would love to make sure that, you know, 5 years from now, we have a wonderful pipeline of young mental health professionals who are dedicated to doing the same good works that you all are doing now. I would love to make sure that we are trying to answer that call that says, you know, I would always tell people from the school district perspective, if the state finally opened, you know, the pocketbooks and provided enough resource for all of our schools to have the mental health professionals that they actually need, that'd be great, except nobody'd be able to spend most of the money because we don't have enough mental health professionals in the first place, right? So, so part of this for me is how do we build that pipeline? And one of the things I would ask you all, and the reason I started with the why did you get involved in this in the first place is, when's the right time to begin having that conversation with people that, you know what, this might be something that you should think about? When do we start that?
You know, it's really funny because in addition to doing this work, this is actually my part-time job. My full-time job is I work for Capella University in their doctoral program for clinical psychology. So I'm teaching that program, and I'm also the director of training for when they're ready to do their fieldwork experiences. But a part of my job is also recruitment. So if I know of somebody that looks like they might, you know, do really good work in this field, first thing I might say is, hey, you ever thought about being like, you know, a therapist or something like that, because you'd be really good at that. I got a resource for you to check it out. And we do. We have faculty referral scholarships. So lots of this is, you know, people in my church that I have seen, you know, people in the community that I have seen. Hey, have you ever thought about doing this work? Because you'd be really good at it. So I think for us, you know, we're gatekeepers to this field, right? But also I think we should be recruiters for this field too. So if it looks like somebody looks like they can actually do really good work here, or you just see like that raw, natural talent in them to connect with people, I'm quick to say you should do this. You probably need to think about this, and I can help you get there. So I've helped quite a few people get on that path to doing this work for a living, because especially when they look like us, because there's just not enough of us, you know what I mean? So I'm all about like stopping people and saying, hey, you ever think about this or thought about that? Or so that's what I think is my job. In addition to being a gatekeeper, I need to pull people in too and say, there's not enough of us. What do you think about this work?
Yeah. I mean, I would definitely agree. Like I do practicum supervision, like I'm a practicum supervisor at Arcadia. And so that to me is very, very meaningful work. I don't think that I would not have dreamed of starting a group private practice had it not been for my mentors and professors kind of pushing me into that. Like, you have a gift, you have a talent for that. And I would definitely agree that we are the gatekeepers. This falls on us to do. I would also, like, I was thinking about the work that like I do with pre-teenagers, right? The work that I do with teenagers. You know, when we're doing that work, we are breaking down the stigma that exists in our community around mental health. I was thinking about, like, the other day, I had a client, and she was talking about a friend of hers who was smoking marijuana, and it seemed like he was smoking marijuana more often. And she said to him, you know, that's an unhealthy coping skill. Like, she's like, you know how you always tell me, you know, Miss Lauren, that that's it's an unhealthy coping skill, and that, what did she say? What did she call it? I can't even remember what she called it. But she sounded like me. Like, she was using the terminology, you know, and she said, you know, there's a reason why I'm not drinking. There's a reason why I'm not smoking marijuana, because I've learned, you know, healthy coping skills. And so I believe that it can even start, you know, at that young age, just breaking down, you know, that it's okay. Even for her, she said she had to get past going to therapy, right? She had to get past, like, I have like little resilience keychains that a lot of my teens and my preteen clients have. And, you know, just the ability, like, that they feel comfortable wearing those keychains, and that their peers ask about what they are and where they got them from, is opening up doors, for our young people to say, like, hey, like there is no reason to be ashamed, and this is valuable work. So I think we can take it a step further, even with that generation, and say, not only is this work valuable and it's meaningful and we're changing people's lives and also the lives of their future children, but that you can actually do this work too.
Yeah.
Like you can do this work in the future. So I think we can also do some of this work like in our schools, with more awareness about mental health and encouraging the next generation, even at that young age, that this is a profession that you can pursue and think about pursuing.
That's awesome. Is there anything else before we kind of end this that you all think that we need to make sure we share?
I guess I just have a few tips that I've been sharing with my clients that hopefully they've been passing on to others that might help to manage our stress during this pandemic. Is that okay if I talk a little bit about
Please.
that? Okay, first things first, stop watching the news. You don't need to be reminded every 5 minutes of how many deaths there are with how many new cases. And then I tell people, too, to turn off the pings and dings on their phones at, updates. The governor is now talking about this. Now the mayor is now talking about this. We don't need to be reminded that we're in the middle of a pandemic. We already know that. The second thing is just making sure that when you talk to people, you're actually looking at them. So FaceTiming and Skyping, I think I said that before, Zooming, whatever platform that you can use to look at the person you're talking to, I think it's helpful because, it brings that human connection back. Another thing I would say is, stay away from people who do a lot of, we're all going to hell, life is over, Armageddon is upon us. You might want to separate yourself from people who spend too much time on that, because I think that can really get in the way of your mood. And, talk to people as much as possible. Keep talking to people. If you're worried and anxious or nervous, tell people that you're worried and anxious and nervous. And also be open with your kids about what's happening, too. So I have a 9 and a 12-year-old, and they ask a lot of questions. So obviously I don't say, the world is ending, but I do have to explain to them why you're not in school, why this isn't happening right now, why that's happening right now. And for the parents that have kids at home, remember you're not educators. You're not trained to teach your kids. So you don't have to have a day-by-day curriculum from 9 to 3 every day. So with my kids, 9 to 10, and then 1 to 2 is all the schoolwork they do every day. Because I think during this time, your social and emotional health is way more important than whatever that classroom teacher is asking you. And just take it day by day. And if you have days where you want to stand in the corner and cry, stand in the corner and cry. Don't stay in the corner, standing in the corner and crying. But if you need those moments of downtime and recharge time, just take them.
Me too.
Yeah, I would definitely agree with everything that the doctor said. I think that a lot of us right now in search of normacy are looking for normacy and being way too hard on ourselves. So, we might need to back up from that stringent 9 to 5 schedule. For a lot of the people that I'm working with and my family members, I'm, trying to help them to appreciate that the time that you wake up, the time that you go to sleep, the time that you eat, those are the most important things that you need to be scheduling. Everything else, you can kind of put into a checklist. And that if you have done most of the things on your checklist for today, that you're okay. We need to be a little bit easier on ourselves right now. There are a lot of women and men and parents that are taking on roles that we never imagined we would have to take on. And so work-life balance is very important right now. And so to just making sure that if we are continuing to work, that we are balancing that, and that we are setting up boundaries for this new environment and this new situation that we're living through right now. I've been doing a lot of self-care assessments. And so self-care is not necessarily, please remember, that self-care is not necessarily a spa day. Nobody's having a spa day right now. So we need to be realistic. Self-care is not necessarily exercising for an hour and a half. We need to be realistic. And so self-care, I've been reminding people that self-care not only is physical, but that we need to be tending to our emotional and psychological self-care daily. That looks different for everybody. Our social self-care, like when we were talking about being connected, making sure that we stay connected in some way with people that we do care about and love. Our spiritual self-care is very important right now. That does not necessarily mean, for some of us, that means prayer. For some of us, that means taking a walk and connecting with nature. For some of us, that might mean meditation. For some of us, that might mean 20 minutes in the bathroom with the door locked with no one asking you for something. But whatever it is for you, making sure that on your checklist that there's something there that will fill the need and that void for your spiritual self-care. And then professional self-care. So whether that means, for me, that means doing a little extra professional development. You know, like I signed up for a little training for a certification that I want to get, and I'm plugging away an hour at a time. But that could also mean, like I said, setting up professional boundaries right now, like what's reasonable and what's not reasonable. And so just, I think that is the biggest thing that I'm advocating right now, making sure that we're hitting all 5 of those facets. And if we do that, then we're going to be okay.
Well, ladies, thank you both for allowing us to have a little bit of your expertise. I know that this call alone would have probably cost me a couple $100, so thank you all for doing it without asking me for my insurance. I do appreciate it, and keep doing it. Keep your spirits up, because we need you all. You all are frontline heroes as well. And this call will be on you for, I suspect, a year plus, because we will have some post-traumatic stress coming out of this also. So be well, take good care of your families, have your families take good care of you, and thank you for joining me.